Let's look now at the chain of infection. And remember, one of our intended learning outcomes is directly related to this concept. So the chain of infection, as I said, uses a metaphor of a chain with links. So in order for an infection to be successfully transmitted, each of the links need to be joined up in a chain for the whole thing to happen. And breaking that chain is how we prevent infection. But we need to really understand that chain first before we can put in place strategies to break those links. So if we look at the chain of infection, we start at the top here. There needs to be a microorganism. There needs to be an organism present that is capable of producing disease in another organism, i.e. us or other people. So that is the first and necessary requirement for the chain of infection to occur. So as we move through the chain, these links in the chain, you should be thinking, okay, if this is one of the chains, if this is one of the links, in the chain, what strategy could we put in place here? And the obvious one here is to eliminate the microorganism. So you can see how the chain then relates to our strategies. So the microorganism requires a place to live, or what we call a reservoir. So there must be somewhere where the microorganism is able to exist and be viable and to multiply if possible. So those reservoirs could be tissues, it could be blood, it could be a respiratory, mucosal lining, it could be anywhere. It could be water, it could be food, all of those things could be a reservoir. So if we're thinking about our chain of infection and breaking it, what can we do to affect the reservoir in order to reduce the risk of infection? Now, these two things are necessary for infection, but not sufficient. So in order for the microorganisms to travel from one person or an animal or whatever it is to another, there must be a pathway. So there must be a way out of the reservoir for that microorganism to occur. So that pathway is important. Then there is the mode of transmission. So once the microorganism finds its way from the reservoir, it needs somehow to travel, or that mode of transmission. And in the earlier video we talked about some of those modes of transmission. Aerosols through the air, direct contact, puncture, wounds, those sorts of things. So again, we're thinking now, aren't we, about how we might interfere here with this chain to prevent transmission from occurring. So if someone is infecting others through sneezing and aerosols coming into the air, what could be a mechanism that we put in place to prevent or retard that type of transmission? But these four steps are not sufficient in and of themselves to cause infection in another person. They all need to happen in sequence, but then we actually need a pathway for that microorganism to find its way into another person or another animal or another organism in order to then infect the host. So how do they get in? We've talked about cuts or wounds. That can be a portal of entry or a pathway of entry for an infectious agent. We can breathe them in, so if someone coughs in the tram, then we can breathe those microorganisms, so that's the path of entry. And again, you can think of ways that we would prevent possibly or block off the pathway of entry. So if a wound in the skin, for example, is a path of entry, then one of the strategies would be keeping our skin intact. And in fact, our skin is one of the most effective protections we have against many infections. So keeping our hands, particularly, keeping the skin and nails intact and healthy is actually something we should be aiming for as oral health professionals or health professionals. But even when a microorganism manages to find its way into our system, we have mechanisms in place to defend ourselves against that. So our immune system, for example, can deal effectively. If the number of microorganisms is low, then we will eliminate it without developing the infection ourselves. Okay? Or if the virulence of the microorganisms is low, then our bodies can defend themselves and infection won't ensue. However, if we're susceptible to the infection, if there's sufficient numbers or sufficient virulence, or our immune system isn't effective, then we are susceptible and we will then develop the infection ourselves. So in order for infection transmission to be successful, all of these events need to occur in sequence. And the key for us in preventing infection is to block or break one of these chains of infection. So I'd like you to look at the documents on LMS so that you get a better understanding of this chain of infection. It's really very important and will appear in assessments. But just generally, there are three ways that we can act in a healthcare setting to break the chain of infection. And generally, they fall into these categories: removing or reducing the organism, or the microorganism, the infectious agent. So if we reduce or eliminate that, then we're cutting that chain directly and preventing infection. We can also put in place things that will intercept transmission, because when patients or other people come into the healthcare setting, we can't be sure that they are free of organisms. In fact, we should assume that all patients are infectious. That's what we should assume. Okay, we shouldn't be waiting until we see signs or symptoms and they're going, oh, that person's got the flu, maybe we should put a mask on. What we should be doing is saying, everybody that walks through that door has the potential to be infectious, therefore I'm going to put in place standard precautions to protect myself and others from infection. But the second thing we can do, so we can intercept that transmission, and barriers, putting barriers between us and the infection, or between the infection and the patient, is the way we would intercept that transmission. And then the third general strategy is protecting the host. So things like vaccinations, which boost our immune system and make them better able to manage infections, are an example of protecting the host or the potential host from infection. So these are the three general strategies which we can employ. So the first one is to remove the microorganism, or to reduce the numbers of microorganisms in the healthcare setting. And there are a number of ways that we can remove or eliminate these infectious agents. But the most important, although it's very basic, but it's the most important, it's fundamental to infection control in the healthcare setting, is effective cleaning. Effective cleaning of the healthcare setting. So all of these things will become contaminated during dental care. So at the end of a procedure, all of these things will be covered with the patient's, hopefully not ours, but the patient's bodily fluids, their saliva, some of their blood. There'll be, plaque. There'll be other things that could contain infectious agents. So the way we clean the surgery after that dental treatment or encounter is fundamental to prevention of infection. And in dentistry and in other areas of health, we clean or eliminate contaminated instruments or equipment in a number of different ways. And I'll refer you back to the ADA Guide for Infection Control for further detail here. But just in summary, what we do is we look at all of the equipment and all of the instruments that we will use in dentistry. and we classify them according to these categories. And depending on the category that the equipment or materials fall into, that will determine how we then clean or eliminate the microorganisms from those. So the categories are critical, semi-critical, and non-critical. And their names really give you some sense about the level of infection and therefore the level of cleaning that's required. So for example, a critical item, i.e. instrument or equipment used in dental care, would be something that penetrates the soft tissue, contacts bone, or enters or contacts the bloodstream. So some examples of these are surgical instruments. So if we're cutting through someone's tissues, if we're cutting through their bone, for example, then that would be termed a critical item. Our periodontal scalers, which you've had a look at, and curettes, for example, are actually penetrating soft tissues and coming into contact with blood. So they would be considered critical items. Semi-critical items are those things that contact the mucous membrane, that is the lining inside the mouth, or non-intact skin. So skin that is has a wound, for example, that would be considered semi-critical. So the things that fall into this category would be the dental mouth mirror, because we put that inside someone's mouth so it contacts their mucosa. So inside the mouth is not covered with skin, it's actually a different type of soft tissue called the mucosa. The dental condenser or the amalgam plugger, and dental hand pieces. So anything that we use basically inside the mouth. And then we have the last category, which is non-critical. These are things which might contact the patient's intact skin, but don't go inside the mouth. So for example, when you have an X-ray taken, the X-ray machine or cone might sit against the side of your face, intact skin, but is not going inside the mouth. Things like the safety glasses that we ask the patient to wear, for example, would be considered non-critical. So all of our equipment is classified, and you should know which category or classification all of your instruments fit into, and that then determines how we manage them after they've been contaminated. So we can do a number of things. We can dispose of things. So for example, a needle that we use to inject into someone's mouth would be considered critical because it's penetrating soft tissues and it's potentially coming into contact with their bloodstream. We can dispose of that. So that's the option for disposal. However, if we were using a surgical instrument like a pair of forceps to extract someone's tooth, it's too expensive for us to throw out that piece of equipment. So we would choose to sterilize it. And there is a process for sterilizing which you will learn about, where we can eliminate all or most microorganisms through a process of heat at a very high pressure. That's sterilization. So all critical items would either need to be disposed of or sterilized. There are no other options. Okay. For semi-critical items, such as the dental mouth mirror, the hand piece, for example, again, we would choose to sterilize those things. That is our choice. That is the option of choice, to sterilize. Now there are some weird little things we use, like a mirror that we no, we don't do that anymore. We used to be able to do that. So let's just go with the sterilize for semi-critical items. That's the way we would approach that. And then we have the non-critical items, such as the radiography cone which we can't actually sterilize. We can't put it under a great deal of heat because we'd actually destroy the piece of equipment. And we can't throw it out because it's too expensive. However, it's not been heavily contaminated because it's only come into contact with intact skin. In these circumstances, disinfection would probably be the appropriate way to do that. Now, you will learn more about the differences between sterilization and disinfection and cleaning later on. But for the moment, just understand that you need to think about these three categories, and then their level of contamination determines how we then deal with those things later. Now, there are some things in the dental surgery that may become contaminated, like surfaces. So if there's a lot of aerosol being produced by a high-speed handpiece, for example, if people are coughing in the surgery, then surfaces may become contaminated. But they can't be sterilised. They can't be put into a sterilising machine. You can't take the bench and put it into the sterilising machine, for example. What we would do in those circumstances is to clean. And the most effective cleaning agent for surfaces is soap and water. So we would ensure that all surfaces that are potentially contaminated are then decontaminated through the cleaning process. So you can see there are various levels of cleaning that are required, and you should know what levels are required for which parts of the equipment from that particular procedure. And we'll learn those things as we go along. Now, I've talked about standard precautions, and we will look at those in more detail in a moment. But one of the important things to remember here is that standard precautions are exactly that, standard precautions. They are the things that we use for every single person who walks into the dental surgery, regardless of what they report in their medical history, regardless of whether they fit into a group that we may think is at higher risk of some sorts of infections. Regardless of anything, we should treat everybody as though they are potentially infectious and operationalise these standard precautions. And these standard precautions basically are these things. Hand hygiene. And hand hygiene just refers to the effective cleaning of hands. Hand hygiene is absolutely essential for the safe practice of healthcare. A person that neglects to clean their hands is a person who transmits disease. We will be very, very focused on hand hygiene with you, and we'll even be examining you on it. The next component of standard precautions is personal protective equipment. So this would include things like gloves, safety goggles, mask, a gown to cover our clothes, those sorts of things. So it's any protective equipment that we use personally during procedures. So clean hands, hands free of microorganisms, personal protective equipment, effective cleaning, and we've just talked a little bit about some of the ideas around how we manage effective cleaning. We also need to manage our sharps in a safe and effective way because we generate a lot of sharp things in dentistry. We also produce waste which can be contaminated with blood, saliva, other bodily fluids, and so we need to dispose of that effectively. And part of our cleaning is also about processing of reusable equipment, and I mentioned before about sterilisation and disinfection. So cleaning or reducing the microorganisms, preventing transmission through barriers, that's the personal protective equipment. And then the last element of those three is protecting the host. So one of our most important things is our immunity, because microorganisms will enter into our system or body, and so we need to ensure that our immune system is as effective as possible. And you can do things to your immune system through vaccination that actually make it more effective. Keeping fit and well and generally healthy yourself is also useful. We can protect ourselves, the host, through personal protective equipment, and we protect others. So the gloves, for example, are not exclusively for our protection, they also protect the patient from transmission of microorganisms from us to them, as does the face mask. Prevents aerosol or saliva transmission from us into the patient's mouth and vice versa. We can also plan our treatment or care so that we minimise the number of invasive treatments for patients. So thinking about how we do minimally invasive care is important. And as I said before, just ensuring that our general health is good is going to ensure that we are more resistant to infection. So, touching on this concept of standard precautions and how important they are, the World Health Organization has defined standard precautions as those things we do that reduce the risk of transmission of bloodborne and other pathogens from both recognised and unrecognised sources. They are the basic level of infection control precautions which are used as a minimum in the care of all patients. So as I said before, we may not be aware of infections that a person is carrying, and they may outwardly appear to be fit and healthy because they are pre-symptomatic, but they may be infectious. So we need to stuff the standard precautions in a way that treats every person as potentially infectious. They are the basic and minimum level that we would use in the care of all patients. So I think these are the critical elements to keep in mind. So when we look at all dental care, all of the dental care we provide in this big box, most of what we do in infection control are these standard precautions. Those basic things that I talked about are what's required to prevent most infection in dental surgeries. There is a small amount of procedures that we may operationalise or use which are based on transmission-based protocols. So let's just clearly differentiate. This is the compare and contrasting between standard precautions and transmission-based precautions. So standard precautions, remember, as the World Health Organization suggested, were the minimal precautions that we need to put in place for all patients. And if we do that, excuse me, we can be fairly confident that we will prevent most common infections from occurring. But there are some weird infections which are not controlled effectively by standard precautions. So there are some things that we might identify as particularly infectious, and they can be transmitted by droplet, by contact, or by aerosol. And we might take additional precautions over and above the standard precautions for patients who we know are carrying those particular infections. And these might include things like you know, the weird ones like SARS or tuberculosis, for example, is one that we might use additional precautions for. But it could also include things like respiratory infections, the flu, for example, where we might want to put into place additional precautions. There are some weird diseases which are relatively new, which are caused by infectious agents which we don't understand very well, the so-called prions. So Creutzfeldt-Jakob disease, or in the media sometimes it's called the human variation of mad cow disease. Those sorts of infections which are we're not sure how to control them, we may then engage transmission-based precautions. But these are reserved only for those cases. Everything else is standard infection control. So this table I quite like, and I've taken it from an update of the Australian guidelines for the prevention of and control of infection in Australia, 2010, and I've put that on the LMS for you as a guide. But you can see here that most of the infections that we want to control in dental surgery, we can manage through standard precautions. That's this orange bar at the top here. So hand hygiene, respiratory hygiene, and cough etiquette. They are enough to prevent the transmission. However, these are the infection types that we might then use transmission-based infection procedures for. So multiple resistant organisms, for example, are becoming problematic. They've got a couple of examples here of particular types of intestinal tract infections like norovirus and highly contagious skin infections. But these are not common. So we would put in place additional precautions, such as a single room to treat these people. In a single room that can be, we can control the flow of air and those sorts of things. Single use or reprocessing of instruments before reuse on the next patient. So we might do things differently with our sterilisation procedures, for example. Droplet infections such as influenza, so the flu virus, if someone is infectious with a flu, but they have to have dental treatment, so they're in dental pain, for example, then we might use transmission-based infections. If they don't require dental treatment, why are they at the dental surgery with the flu? Okay, so we would say defer treatment until they have recovered. But if we had to treat them, or if there were things like norovirus, pertussis, so that's whooping cough, or meningococcal infections, if the dental treatment was required, and hopefully it wouldn't be when they were that sick, then we would ramp up our infection control procedures as well. We would use a surgical mask rather than a paper mask, for example, or we may decide to use disposable gowns instead of laundered gowns, for example. And then there is a group of airborne viruses such as I said, pulmonary TB, tuberculosis is a disease that really has been less of a problem in Australia recently, but with migration is now rearing its ugly head, and we're getting types of tuberculosis that are resistant to our treatments. So you'll notice also chicken pox, which is spread by airborne droplets, measles and SARS here. So those sorts of infections we would again defer treatment if we possibly could, but if we can't, if they're in pain or need to be treated and they remain infectious, you can see here that they're potentially talking about negative pressure surgeries or rooms with negative pressure to control those aerosols to ensure that they're not spread to other people. So you can see here the major difference between standard precautions, which is what we do every day with most people, and then transmission-based or disease-based additional precautions which we would take in these cases only. So things like HIV, hepatitis, for example, are not treated with additional or transmission-based precautions. They are managed effectively with standard precautions. So the things to be really scared about are not HIV and hepatitis, but things like pulmonary TB or the flu virus, because they are dangerous and can kill, and are easy to transmit, whereas HIV and hepatitis B, with standard precautions, is very difficult to transmit those diseases. In fact, there's very little evidence of transmission in dental care of any of those diseases to date. So standard precautions versus transmission-based.